araw at welcome sa Cabrini Health Access. Isa na namang makabuluhang talakayan ang handog namin sa inyo. At halina't pag-usapan natin ang makabagong machine na kalimitang ginagamit upang matukoy ang ilang sakit. But before the discussion, let us all first watch this video.
MRI stands for magnetic resonance imaging. You'll see some of the remarkable images produced by this type of medical imaging exam. These are MR images of the brain. They're astoundingly clear and detailed. Here, in addition to the brain, we can see the spinal cord, sinuses, teeth, and even the blood vessels. Just what makes MRI so different from other medical imaging techniques?
Ayan, that's right. Pag-uusapan natin ngayong araw na ito ang tinatawag na magnetic resonance imaging or yung MRI na tinutukoy. And the good news is, yung MRI is soon available na dito sa St. Francis Cabrini Medical Center. And that's why pag-uusapan natin ngayong araw na ito. And we invited one of the radiologists here in Cabrini to give you some tips or a little bit background about her. Our guest for today is from Talisay, Batangas. She took her medical degree and underwent radiology residency training at University of Santo Tomas. She had her CT MRI and Radiology Fellowship at St. Luke's Medical Center, Global City. She also underwent an extended fellowship program on fMRI and image-guided brain surgery at Golby Lab, Brigham, and Women's Hospital, Harvard Medical School in Boston, Massachusetts. She also actively practices MR imaging with special interest in neuroradiology in centers in Metro Manila and Cebu. She is also affiliated in several hospitals here in Batangas, including St. Francis Cabrini Medical Center. Let us all welcome Dr. Maria Kristine Mendoza. Magandang araw po at welcome po sa St. Cabrini Health Access.
Good afternoon and thank you for having me.
To all viewers na nanonood sa ating Facebook, you can send your inquiry through our Facebook comment section below. And for those who are nanonood sa Galaxy Cable, you can send your inquiries through our Facebook page. It's St. Cabrini-corporate page. To start our discussion, Doc, by defining what is magnetic resonance imaging or yung tinatawag nating MRI.
Okay, so you already said magnetic resonance imaging or MRI is a type of imaging modality, okay, that takes pictures or images of our body in high soft tissue detail. So, ang pag-acquire ng image in an MRI is different from image acquisition dun sa ibang imaging modality such as CT scan, X-ray, at saka ultrasound.
And then, Doc, how about how does MRI work?
So as I've said, the manner of image acquisition is different. So with MRI, it utilizes a powerful magnet and a computer to take images of your body in slices. So the magnet is actually able to accommodate structural and functional imaging of the human body. So we can diagnose many diseases and many conditions using MRI, and it has its advantages compared to the other imaging modalities.
Okay, so I would just want to clarify, Doc, if yung MRI is much better than CT scan?
Yung dalawang imaging modality na to, when a physician or a clinician requests for this, usually it's used for different indications. So merong mga conditions na better diagnosed with MRI,
Okay.
and meron din naman na better diagnosed with CT scan. But the advantage of MRI over CT scan, one important advantage is that it doesn't use radiation or ionizing radiation. So walang radiation exposure, unlike in CT scan and X-ray.
Yes, Doc. And Doc, what are conditions can an MRI help to diagnose?
Okay, so one of the many conditions na mas sensitive ang MRI compared to CT scan would be stroke.
Stroke.
Okay? Especially doon sa early stages or the hyperacute phase of stroke. Sometimes kasi, kapag maaga pa, yung mga less than 3 hours ang symptoms or yung onset of neurologic deficit, hindi siya nadedetect by CT scan. But with MRI, even minutes after, it can be diagnosed, and if the patient is eligible, an appropriate treatment can be given. Other structures that can be seen in MRI na hindi masyadong nakikita sa CT scan would be structures of the musculoskeletal system, specifically yung mga ligaments, cartilages, at saka yung mga tendons, hindi yan nakikita sa CT scan. But with MRI, you can even diagnose tears or degeneration, yung mga because of aging na changes, using this imaging modality. Other advantages, you can do non-invasive evaluation of the biliary tree. So, merong ginagawa yung iba na ERCP, so that's an invasive procedure, but with MRI, you can evaluate the biliary tree by using just the MRCP or the magnetic resonance cholangiopancreatography. Yung mga madadiagnose niya, among others.
Doc, if ever yung patient is na-detect siya, stroke patient, and then i-refer siya for MRI, what preparation should the patient must do?
Well, actually, if the patient will undergo a non-contrast study, walang kailangan na fasting or any other special preparations. Specifically for patients na stroke, that we are, for example, trying to catch up with the golden period of giving thrombolysis, ine-expedite talaga yon. So there's no contraindication except for yung mga restrictions ng implants, pacemakers, or any material inside the body of the patient na ferromagnetic and is contraindicated in the MRI environment because of the magnet. Kasi yung ferromagnetic materials or devices with ferromagnetic materials, it can be attracted by the magnet. So, that will be detrimental to the patient and also for the machine. So, as I've said nga kanina, ferromagnetic materials are contraindicated in the MRI environment. So, that is both for the patient and the personnel who will be entering the MRI environment. Kaya, every person who will enter yung mga restricted areas in the MRI room or MRI unit will have to undergo a very strict screening process.
Yes, and especially yung mga nag-undergo ng may operation with brace. Yan, Doc.
Mga surgeries na naglagay sila ng implants.
Yes.
Even, for example, mga surgeries, for example, angioplasty, we have to be very particular with the coils and with the materials that may have been implanted. And we usually ask the physician, the requesting physician, to provide us with either the OR tech, and especially the make and model of these implantable materials, para we will know if these are MRI compatible. Kasi if they are not MRI compatible, we cannot definitely scan that patient.
Yes, ayan. Doc, how about yung mga patient with braces?
Okay.
Are they going to refer them to sa mga dentist nila to remove yung braces nila before undergo ng MRI?
Well, actually, with dental devices, yung mga removable devices, of course, we would advise talaga for them to remove it. But for devices na permanent or yung mga brace talaga na naka-fix, it's not contraindicated naman. Most of the materials are MRI compatible. Pero, ang problem lang is, if ang isa-scan na area would be near the brace, like for example, the head region or the neck region, yung brace na yon can actually cause artifacts. And these artifacts would obscure the images and would limit the evaluation. So, kapag may braces, minsan tinitest muna namin, lalong-lalo na dun sa may tatawag kami kasing sequences sa MRI na very sensitive doon sa ganong materials, tinitest namin kung interpretable ba yung image or talagang maraming parts ang natatakpan na hindi mai-interpret. So in those cases, we would opt to discontinue the examination and advise the patient to either have the braces removed kung talagang indicated na gawin yung MRI.
Yun. Doc, is this for the safety of the patient or this metal device will affect the result of the
That will affect the interpretation.
Oh, okay.
Okay, so as I've said, just to reiterate, most of the braces naman kasi MRI compatible na yung material. So, it doesn't really pose parang hazard to the patient. Ang detrimental lang siya is with the interpretation kasi nga, there might be structures na matatakpan, no artifacts that is caused by the braces or the dental device. Lalong-lalo na kung dun sa malapit na area. Pero kunwari, knee naman ang papatignan mo, or abdomen, or thorax, okay lang.
No need na.
No need na to remove that.
Okay, ayan. So, na-discuss na natin yung, yung screening before the scan. So, what do we expect naman before, during, and after the scan of the MRI?
So, before the scan, as I've said, if it's a non-contrast procedure, walang special preparation. But if it is a contrast-enhanced procedure, meaning magbibigay tayo ng gadolinium-based contrast, may fasting yon or non-per-orem ng 3 hours. Okay? So, walang kakainin, walang iinumin prior to the examination. 3 hours prior to the examination. And then, pagdating ng patient doon sa MRI unit, usually, ina-advise namin for them to arrive at least 30 minutes before the procedure. Kasi medyo yung process of screening natin, as I've mentioned, would be very, very meticulous and strict. This is for the safety of the patient din naman. So, after that, kapag na-screen na sila and there's no contraindication, and you also have validated na talagang indicated to do the MRI, we would proceed with the scanning. So, yung sa scanning naman, during scanning, ang pagkakaiba niya with CT scan, mas matagal ang scanning time ng MRI. Sa CT scan, usually it will just take you about 2 minutes na in and out. For an MRI procedure, it can range from 30 minutes, yung pinaka siguro shortest natin for like, let's say, a routine brain exam, to mga 90 minutes for contrast-enhanced procedures and for special procedures. So, medyo matagal. Oo. Kaya, yung mga patients, although walang dietary restrictions, we do not advise na uminom sila ng marami or uminom na caffeinated drinks. Kasi minsan, kailangan nila magpaalis because they would want to urinate.
Yes.
Panibagong planning na naman yun once maialis ka doon sa position na nandun ka na dapat. Okay? So, that would cause undue delay rin for the scanning. So, during scanning, in the scanning room, the patient should also expect thumping noises. So, as I've said, ang ginagamit natin dito is a magnet. It's always on. So, meron kang noises talaga na maririnig. Actually, ang description ng iba is parang yung noise ng train in the railway.
Medyo maingay.
Maingay. Kaya, yung patients na pumapasok doon, talagang binibigyan ng earplugs at saka earphones na may music so that it would lessen the noise and also help with the anxiety of the patients. Kasi may iba na-anxious sila because of that noise. And then, so after the scan is done, after that, wala namang matagal na waiting time unless may contrast reaction na mangyari. That's when we observe or refer the patient to the ER. Pero right after, kung walang nararamdaman ng pasyente, the patient can immediately go home.
How about, Doc, the difference between MRI and CT scan?
So, these two imaging modalities actually, may mga certain conditions kasi na better ang MRI to evaluate or meron din naman na better ang CT scan to evaluate. Pero, for conditions wherein you would want better soft tissue details, MRI would be a better modality to evaluate that. Another advantage of MRI is that it doesn't entail using ionizing radiation, unlike CT scan and X-ray. So, dun sa part na yon, that's very advantageous for children. You don't want children kasi to be exposed to too much radiation. And even for the general public, I mean, yun ang isa sa malaking advantage ng MRI.
Thank you, Dr. for answering the first set of questions. So, na-discuss na natin kung ano yung MRI and how does it works. And after our break, Maria Kristine Mendoza will answer yung question from the live viewers. Magbabalik po ang St. Cabrini Health Access. in Cabrini Health Access, and we're still here with Dr. Maria Kristine Mendoza, and we're talking about MRI. So, Doc, let's proceed on answering the question from the live viewers. Yung first question po natin ay galing kay Joy. Ang sabi po niya, how long does the MRI scan take?
Okay, so ang MRI, yung mga routine procedures, like for example, a routine cranial MRI can be as short as 30 minutes. Pero kung contrast-enhanced procedures or the more special procedures, it could last up to 90 minutes or even 2 hours. Talagang mas mahaba siya ng CT scan. Kasi nga maraming image acquisition na nangyayari.
Doc, I just want to have a clarification about contrast. Kasi nabanggit mo kanina yung non-contrast and with contrast. Why we give non-contrast and non-contrast? Parang naano ko lang.
So, yung contrast that is used in MRI is gadolinium-based. It's totally different from what's being used in CT. Yung contrast kasi, it can enhance, okay?
Yes.
It can enhance certain structures or pathologies. Yes. So, it could help in delineation of certain tumors, in characterization of certain diseases. So yun, meron kang mga madadiagnose with the addition of contrast. Yes. Another example would be, for example, the MRI can actually do an angiography, or it can take images of the blood vessels even without contrast. So yun yung isang advantage siya with CT scan. You can visualize the vessels even without contrast. Ang tawag doon is yung time of flight angiography. Pero still, mas sensitive pa rin for evaluation, for example, of stenosis kung magbibigay ka ng contrast. So, yun yung mga areas wherein, or advantages of giving contrast. Pero, hindi naman lahat kailangang bigyan ng contrast. It's really indication per indication, or disease per disease. And the one that determines the need for contrast is actually the clinician, kung ano yung kino-consider nila.
Ayan. Yung second question natin ay galing po kay Gerald. Ang sabi po niya, when and from whom will I get my result?
Okay. So, the MRI images are actually interpreted by a radiologist. So, kami ang nag-i-interpret no. And for routine exams or elective examinations, we can provide official results within 24 hours after the scan. Pero in cases of stat examinations or those that are on call na kailangan talaga na ng result, we can provide the result. We can actually provide the result within 2 hours. Ano yun? We can call the clinician kahit verbal lang to relay critical findings or kung negative, and then provide official result within 4 hours of the scan.
So, yung next question po natin ay galing kay Princess. Ang sabi po niya, safe po ba ang MRI for the pregnant?
Okay. So, there are no studies that show na may harmful effect ang MRI sa pregnant women. Pero kasi, hindi rin siya useful in the evaluation of the baby if it's less than 16 to 18 weeks AOG, or age of gestation, kasi hindi pa formed our organs. So, kung may other way to evaluate, siguro it would be more recommended kesa ipa-MRI. Although, as of now, wala pa yung studies na nagsasabi that MRI has any harmful effect both sa mother and sa baby. But it's different for contrast-enhanced procedures. Kasi, once you give contrast, yung gadolinium, which is actually the main material of the contrast, can cross the placenta. So yun, pwede magkaroon ng effect kay baby. Although, it's not well studied, kasi ethically, you cannot parang give contrast just to see kung ano yung magiging effect. So, pero they know that it can cross the placenta, and it may have some effect with the fetus.
Okay. Yung next question po natin ay galing kay Roy. Ang sabi niya ay, will the exam cause any pain or is there any side effect after the scan?
Okay. So, if the patient, as we said, every patient will be well screened. Kung well screened naman yung pasyente, usually we do not expect any complications. Walang pain after the exam. Actually, right after the exam, if the patient is ambulatory, he can go about his or her usual activities.
Okay. Sabi po ni Menard, pwede bang magpa-MRI kahit may tattoos and permanent makeup?
Okay, so for tattoos and permanent makeup, which is actually tattoos as well, ang risk kasi would be when you are in an MRI environment or doon nga, some exposed to the magnet, there may be heating. Mag-iinit siya. Okay? And the risk is specifically if yung ini-image would be at the area where the tattoo is. For example, hand ang gustong ipa-MRI, tas nandun din yung tattoo, mas malaki yung risk na mag-heat siya. But we can also take special precautions kung talaga kailangan i-MRI, like put parang wet cloth para hindi masyado mag-init. And also at the event na talaga kailangan ng MRI and there's a tattoo, meron namang ways of communicating yung patient na nandun sa loob ng MRI to say na parang may nag-iinit sa katawan niya. Meron lang siyang ipupush na button and we will be alarmed na meron ng ganong instance and we can pull the patient right away para hindi na mag-cause ng burns. Okay. Another problem with tattoo and permanent makeup, if the MRI is done mga within 6 weeks of its application, hindi pa ganun katagal, there is the risk of smudging. Okay? They say that the ink, some of the inks used may have ferrous material. So, kung hindi pa siya embedded, it can smudge.
So, yung next question natin ay galing kay Clarice. Ang sabi po niya, pwede ba akong magsama ng relative sa MRI scan room?
Okay. Actually, ang isa kasi sa parang nagiging limitation din for patients sa MRI, for MRI procedures, aside from yung mga implants nga na hindi pwedeng ipasok doon, is claustrophobia. Okay? Meron talaga mga patient that they panic when they're in an enclosed space. And an MRI scanner is an enclosed, it has an enclosed door, kaya, tas matagal ka pa doon. So talaga it can cause anxiety. And especially for claustrophobic patient, they cannot tolerate that. Okay? For these instances, minsan kahit kasama yung relative, hindi sila na-appease. Minsan, it will entail referral to an anesthesiologist para i-sedate sila so that they can tolerate the procedure. And of course, i-evaluate if they really need that procedure or if there's any other option. Okay? Pero doon naman sa iba, like for example, children. Okay? An adult can accompany the child inside. Pero, as I've said, every person that will enter the MR environment will also undergo screening.
Yes.
So, isi-screen din sila for, again, the contraindications na pwedeng ipasok dun sa MR. So, kung may implant or metal yung kasama, maghahanap tayo ng ibang makakasama. Okay? And yung sasama din dun sa loob ng MR environment will be also provided with earphones. Kasi talagang bothersome din yung sound so that it will somehow lessen the sounds of the MRI.
Okay.
Pero pwede naman magsama.
Pwede naman
if really needed.
Para maging successful din yung
Yeah, kung kunwari anxious sila and they need support, some emotional support from a relative. So this is different from claustrophobia. Claustrophobia kasi talaga we would see in the monitors na talagang there would be increase in heart rate, increase in BP. So there are really claustrophobic patients that parang ang kailangan nila is not just emotional support but really sedation to calm them down.
Yes.
Pero meron namang iba na they're just really anxious and they just would want somebody that they know to be with them inside. Wala namang problema. Kailangan lang screen talaga rin yung sasama na relative or companion.
Naka-experience na kayo, Doc, ng claustrophobia?
Yes, yes. You know, before I thought na hindi siya, parang I have not really encountered it much. Pero when I became a radiologist, you can really see, hindi siya yung tipong nagdadahilan lang yung pasyente. So we have MRI-compatible monitors that we hook the patient in while they're inside the scanner so that we can also monitor their vital signs. And if the patient is claustrophobic, it really reflects. As I've said, they would present with tachycardia, bigla na lang tumataas yung heart rate, tumataas yung BP, nag-hyperventilate. So, yun, talagang merong claustrophobia.
Okay. Ang sabi naman po ni Cindy, pwede po ba ako magpa-MRI if I have magnetic flashes?
Oh, okay. So, it's just recently studied. Kasi actually, parang medyo recent din lang naman yung pagkauso ng magnetic flashes. It is, parang in this particular study, which is fairly new, it says na it can cause significant artifact. Meaning, it can distort the image. That would affect the interpretation. Pero, I don't remember if it mentions kung ano yung magiging, kung it will be pulled by the magnet. Pero as I've said, anything that can be detached from the body, like jewelry, kahit na sabihin mo na walang ferrous material yan, we really advise them to remove it. So I think that goes with magnetic lashes as well. Kasi these are removable, lashes.
And for the best result, kailangan talaga mag-follow din tayo sa rules nila. Kapag may alam natin na magnetic siya, tanggalin na natin.
And more than the best result, it's really for safety.
Yes.
It's really for safety because, this is a powerful magnet. Kaya talagang we are going to be very strict with the screening. Kasi MRI is a very powerful imaging tool. Basta naman screen, anybody can utilize this imaging modality.
Okay. Doc, general advice na lang po sa ating mga viewers regarding MRI.
Well, my general advice is, number one, the request for an MRI would actually have to come from a physician. Kasi nga, there should be an indication to doing the examination. Because as in any procedure, it poses risks. And again, it entails really strict screening as who can enter the MR environment and have the examination done. Pero, we also have to keep in mind that MRI really has its advantages in the diagnosis of many diseases. And that would really help the clinician in the management. Okay, so yun, I think this is a good avenue for public awareness of what MRI is and what it entails, both for the patient, the relatives, and the personnel of the hospital as well. So just a few reminders, if you're going to undergo an MRI procedure, first, you have to disclose, again, presence of any implants, or if you have undergone any operations. Although, of course, we're going to be providing screening forms, so you have to answer that diligently. And number two, as I've said, this is a long-running procedure compared to a CT scan. So when you're inside the MRI scanner, it is very helpful to expedite the examination as well, na you stay still in the gantry. And again, screening would be very, very critical so that the MRI may be done safely and interpretation will be done effectively.
So much again, Doc. And to keep you guys updated on all the happenings in St. Francis Cabrini Medical Center, make sure to like our Facebook page. It's St. Cabrini-corporate page. Muli, ako po si Rizal Marqueses and this is St. Cabrini Health Access.